We're now joined by Dr. Kathleen Neville, who is Associate Dean for Graduate Studies and Research at Seton University College of Nursing. Good to see you, Doctor.
Good to see you again. It's nice to be here.
Let me ask you, the biggest impact on nursing from this pandemic as we tape this program going into the summer of 2022?
Okay, so the impact on COVID, both in nursing and nursing education, still remains to be very dramatic. What we're seeing in the field, in nursing in general, is COVID created tremendous shortages. So we still have shortages now. During the stress of COVID, nurses became very fatigued. They were exhausted. We saw many, many nurses leaving the field. And now, as a result of that, we see many nurses who remained, both new nurses and those that remained, they're overworked and they're stressed. So the climate is still one of overwork, and so that still remains.
Doctor, you've talked to our producers, and because you've done a lot of research in the area of the opioid crisis. Tell everyone what fentanyl is and its connection to this crisis and opioid deaths.
Okay, so we're seeing an escalation of opioid-related deaths, and it's predominantly due to the increase of illicit fentanyl. Fentanyl is a drug that that's been around, and it's a very effective pain medication, used in cancer extensively. But illicit fentanyl now is you need such a small component of it. It's enough to cause respiratory depression. So nationwide, we're seeing such an escalation. For instance, in our grants that we have at Seton Hall College of Nursing and the School of Health and Medical Sciences and the med school, we have two grants. One just ended, and it's to train students to be able to prescribe medication-assisted treatment. Because of fentanyl and the illicit fentanyl, and it's all over the streets, and from what I've read and when I go to conferences, most of the heroin on the streets in New Jersey and nationwide has fentanyl in it, so it kills. So when we started our first grant, we saw a mortality rate. The CDC, I think, when I was writing the first grant, cited a mortality rate of 48,000 annually in the United States. Then in 2020 with COVID, it hopped up to, I think, 78,000. Now last summer, it was reported of over 100,000 deaths per year in the United States, predominantly due to illicit fentanyl in the opioids. It's actually fentanyls in all substances now.
Let me ask you this and shift gears dramatically to a really positive subject. You won a Fulbright scholarship.
Yes. So
first of all, it's such an impressive thing. I'm not sure everyone knows what it is. Tell everyone.
Okay, so it actually was on my bucket list, and now I'm very proud to say I'm a Fulbrighter. So the Fulbright is really, the Fulbright UK-US Commission is really an opportunity for a cultural exchange for teaching and research activities. So what I will be doing, because I studied nurses' knowledge, attitudes, and perceptions about caring for people with opioid use disorders in the United States. And basically what I found in several studies is that nurses are fearful of people with opioid use disorders. There's a lot of stigma, and that's what our grant and our training of students is really working on. But this, the opioid epidemic is now worldwide, and Scotland has a very high opioid mortality rate as well as the United States. I think it's third in the world. We're number one. Estonia is number 2, and Scotland is number 3. So the Fulbright is really an opportunity to engage in research, but it's also a cultural exchange. I hope to start a collaboration between the Edinburgh Napier University School of Nursing in Edinburgh and bring it back to Seton Hall, and there will be years of cultural exchange and learning, travel, learn. So it's really a wonderful opportunity to represent United States as almost like a cultural. I'm not working for the U.S. State Department, but it's really to serve as a cultural ambassador. So it's really a big honor, and I'm thrilled. I go in August.
Well, congratulations. That's awesome. Before I let you go, as a student of leadership who's taught at the Buccino Leadership Institute at Seton Hall University
for the last several years,
nurses as leaders, give me 1 minute or less.
Nurses as leaders. It's so important that, nurses are front stage in nursing leadership. At Seton Hall, many of our graduates they're now presidents of healthcare systems. We have several in New Jersey. So who better than nurses to really be leaders in healthcare? And it's just demonstrated. Nurse leaders are at the bedside. They're in corporations. They're in community health centers. They're leading major healthcare centers, both in New Jersey and nationwide.
Nurses are extraordinary.
Thank you. We are.
Yeah, and not just because the way they care for people, particularly in their most. And I've been on the other end of that as a patient and as a family member of a patient in our most vulnerable states, but. They're also, like you said, amazing leaders who just don't get enough credit. Dr. Kathleen Neville is Associate Dean for Graduate Studies and Research at Seton Hall University, one of our higher ed partners, the College of Nursing. Good to see you, Doctor. Thanks so much.
Thank you. Bye now.
Steve Adubato, see you next time.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the Russell Berrie Foundation, Hackensack Meridian Health, TD Bank, NJM Insurance Group, Veolia, the Healthcare Foundation of New Jersey, and by New Jersey Sharing Network. Promotional support provided by New Jersey Globe and by CIANJ and Commerce Magazine.
Many of New Jersey's children have been affected by COVID-19, but now that there is a safe and effective vaccine available for children ages 12 and older, you can help make COVID-19 history by getting yourself and your child vaccinated. Let's end this pandemic together and help all children get back to being kids. Visit hackensackmeridianhealth.org/COVID-19 to learn more or to schedule a vaccine appointment today.